Hello, this is Herman Oosterwijk and this is a presentation about XDS, and the topic is the early implementation issues with XDS, which is part of the presentation at the IHE showcase at HIMSS Latin America in September of 2014 in Sao Paulo. Before I start, I'd like to give credits to many IHE team members that post all the presentations and post all the slides. So several of the slides that I use are not original, they're borrowed, so to speak, from the IHE team members that put a lot of information in the public domain. But now let's talk about the IHE-XDS profile. And I split this presentation in 4 parts. First, I'm going to talk about what is XDS, then how it relates to the ITI technical framework, talk about the XDS family, and then we'll finish off with some early implementation issues. So if you are familiar with XDS and ITI and family, you might want to skip straight to part number 4, which talks about the early implementation issues. Before I start, I just like to highlight in particular the situation in Brazil, because this is a presentation that I'm doing here at the Sao Paulo conference, and many organizations, many governments have actually adopted XDS as their interoperability standard. Brazil, for example, adopted this already in 2011, and they say as part of the Ministerial Act 2.73 that XDS is a critical part of the interoperability standard, as well as IHE, PDQ and PIX profiles, what we're going to talk about in the later part of the presentation as well. So XDS, it's a requirement by many governments, and that's why it's so important. Now XDS by itself, we'll talk about, is basically a series of standards. If you look at XDS, they have a family of standards. They are called XDS-I, XDS-SD, XDS-M, SDR, as well as XCA. And there's also a D-sub, I call it, where we can submit information about the metadata. So it's a family of standards. So I will go quickly through that because we're going to really spend more time in the other parts of the presentation talking about that. But as you can see, there's not only XDS, but there's also the family of XDS, what I call, but also other components such as the security and privacy management that is needed. Then in addition, there is a patient identity management, which is where the PIX, PDQ and XCPD comes in. Then we need to provide the provider and personnel management, as well as the workflow management and the content management. So all of it is needed to create an infrastructure for XDS to be successfully implemented. But we're going to first talk about XDS by itself. So what is XDS? XDS stands for Cross Enterprise Document Sharing, and there's also a version for imaging. And IHE stands for Integrating the Healthcare Enterprise. So it's an IHE integration profile. It facilitates the registration, distribution and access across health enterprises of patient electronic health records. For example, if a patient is discharged from a hospital because he was admitted to the ER, let's say for an afternoon, when the patient is being discharged, a discharge document will be created by the EMR, the electronic medical record, at that hospital, and it can then be shared using the XDS mechanism, the XDS protocol, with the primary physician. So it provides a standards-based specification for managing sharing of documents between any healthcare enterprise that says I support XDS. And again, standards-based is very important because if you would implement a system from vendor A that says I do XDS, it should be able to talk with a other enterprise that says I also implement XDS, and that could be from a totally different vendor. There's also a version for document sharing for scanned documents, and kind of a transition. We really want to make sure that we have all the documents in electronic format so they can directly, the discrete data can be imported in the receiving. But as a temporary solution, there might be a lot of scanned documents that could be adopted as well or exchanged as well. What are some of the use cases? Well, first of all, a patient summary, for example, within a region. And you could have a publishing or a care summary by providers, such as a hospital or a specialist. And then the nice thing is that in the case of an emergency, let's say the patient goes to a hospital in the other side of town, the hospital could within seconds basically access all the information of that patient that was treated or where the records are at his other hospital or at his primary care provider. Another use case would be an e-referral between primary and secondary care providers. For example, a patient is seen by a physician, primary care physician, and the primary care physician says, well, you really need to see a cardiologist based on the EKG that they just did. Here's some of the data, so you can refer that directly to your specialist. Another use case would be sharing of radiology reports and images between facilities. Many, in particular in the United States, there's a lot of clinics that pop up here and there, and they basically are imaging centers where the patient is being scanned, for example, on a CT scanner, and the report or the images could be shared between different facilities, for example, the main hospital or another facility. The same with laboratory results, laboratory reports. Laboratories could share that information with ordering physician and other care providers. And then last but not least, definitely the e-pharmacy. Ambulatory physicians could provide a prescription, and the prescription information could be sent automatically to the pharmacy, and the pharmacy could send information back to the physician about the prescription that was administered. Now let's look at the Health Information Exchange Network, for example. So XDS really requires a Health Information Exchange Network. And why is that? Because XDS, in its proper form, requires a document registry. So for example, in our case, there might be a teaching hospital. In the teaching hospital, patient has been administered to the emergency department. Information is sent from the emergency department application and archived into the PACS system. The PACS system might have a couple of images, and that is forwarded to the EHR system and as well to the enterprise archiving system. Now, how does the teaching hospital tell the outside world that there is information available? Well, it registers the document or the image with a registry. If later on the community clinic wants to query, it will query the document registry, find information about the document, because there's a link back to the teaching hospital, and can then retrieve this particular document. This was a description of the use case. How does it technically sit together? So if you really think about it, there are 4 actors. There's a source of the document. In this case was at the university hospital. There's a repository, which in many cases could also be the same location, but it doesn't have to be. But in many cases, the source and the repository is combined. Then of course there's the outside registry, and then we have the consumer. So the source of the documents sends a post document packages to the repository. The repository registers the documents, including metadata. We'll talk about metadata later, and a pointer with the registry to say, oh, I have these documents and these images for this particular patient. And if you look at the metadata description, the metadata will be like the class, patient ID, the author who created this document, what the facility, it was done at so and so hospital, date of service, and so on. So the consumer, and that was that community clinic, would search for the document with specific document information about this patient. He gets back the pointer and can then retrieve these documents. Now technically, what's happening, there's a set of commands, defined commands going back and forth. What are these defined commands? Well, if you look at this slide, the defined commands are defined by the IHE technical framework. So let's take one example. The provide and register document set from the document source to the document repository is done with the transaction called IHE-41. Now, if you go to the IHE website, you download the IHE technical framework, there's a document called Description of Profiles, and there's a whole set of documents that says transactions. So if you look at transaction 41, it will tell you exactly how to register. The same thing with a registered document set between the document repository and the registry. There's an IHE-42 that tells you exactly how to register, and so on. So all of the details of these standards are described in the IHE technical framework. And what they do, they basically refer to existing standards, for example, HL7 or DICOM. And then they say very specifically, of this HL7 transaction, these fields are required and these are optional. And that's what interoperability is all about, to reduce the optionality and specify exactly what goes back and forth. So what are the main systems and what is the responsibility? We have a document repository, a actor. So the document repository, for example, a VNA, vendor neutral archive at a hospital. And it is responsible for storing the document in a transparent, secure, reliable and persistent manner. Why? Of course it has to be reliable and persistent. Why? Because if the repository registers that document, the other parties have to be rely on the fact that later on they can retrieve that document. A document registry is responsible for storing the information or the metadata about this document, for example, where it came from, the creator, the author, and so on, so that the documents of interest may be easily found, selected, and retrieved, irresponsible of the repository where they are actually stored. So it could be hospital 1, 2, 3, it really doesn't matter. Now, any IT system, point of care, may act as either document source. Document source are actors that can register, or document consumers that can query, for querying and retrieving the relevant documents. So I made a note, if you think about the registry, it's really a library. It's like a book repository and a catalog index, like with index cards. The registry does not have access to the documents, right? An important separation from security and privacy perspective. The registry only knows where the information is. The document consumer would be the actor that potentially get access to the document from the repository, assuming that he or she is authorized. And I can have multiple repositories linked to one registry, and that's the most common use case. There's also an XDS specifically for imaging. It's called XDSI. And if you look at this particular chart, and you see it is identical, almost identical to the one I put before. The only difference is that, and I highlighted this, that the imaging document consumer uses a different protocol. Because as you can imagine, to retrieve a document is quite different than retrieving a multiple megabyte or sometimes hundreds of megabytes of imaging information. So we have a special version of the DICOM standard called WADO, W-A-D-O, Web Access to DICOM Objects, that allow the images to be retrieved. Not only can we retrieve images, but also reports, what we call key images, evidence document, and presentation states. To be clear, when people say I do XDS, you really need to specify what actor. Actors are the document source. It's the producer and publisher of documents. It could be a PAC system. And they are responsible for sending the documents and the metadata to a repository. The document repository, for example, a vendor-neutral archive or a PAC system. It could also be an archive system in the cloud, for example, a storage service provider. Is responsible for persistent storage, as well as the registration with the document registry. So the document registry maintains the metadata about each registered document and the links to the document in the repository where it is stored. I can query as a consumer back to the registry about the documents using specific criteria. For example, I want to find out all the documents for my patient with a particular modality, like all the CT scans. For example, from specific locations, from specific authors or physicians. Then the document consumer can query the document registry, for example, the primary physician, for the documents that meet certain criteria and can retrieve them from one or more repositories. In addition, we need a patient identity source, because if I say I want the images from John Smith, I need to know which John Smith I talk about. John Smith is, of course, a very common name in the United States. So I need to provide a unique identifier. And that facilitates, so the patient identity source facilitates the validation of patient identifiers. And then I want to talk a little bit about the fact that we have in many cases an integrated document source and repository that combines the functionality of the source and the repository. For example, a PAC system. This will be the source and repository in a single actor. It does not expose the provide and register set transaction. So that's what XDS is all about. So it's important to understand that XDS, when people say I support XDS, that XDS consists of several actors with well-defined transaction between them. And I put this picture there of an engine. So XDS is an engine, different components, has a cylinder, has a transmission, right? So different actors. So this does not make sense to say I do XDS without saying what is the actor that you specify. So you need to make sure what flavor of XDS. Also, you do XDS, XDSI, and I1B and so on, and what kind of actors. I listed the profiles, so I made a list of all the different terms. So when I talk about XDS, XDM, XDR, XPDQ and so on, here's the list for your reference that you can refer to find out which one I'm talking about. And then last but not least, of course, any information you like to read more about our classes, training, go to the OTech website. And the IHE website, IHE.net, gives all of the information about the profiles, about the XDS profile, and very importantly, about the transactions that are part of the profiles. For example, remember ITI 41, can I find out exactly what DICOM 807 or web services or whatever the transaction is and what is in that information. Okay, thank you very much. There's a couple more parts to this. If you are interested, we can go listen to the other components, other parts of this presentation. This was the XDS proper. We'll talk about the XDS ITI profile, ITI environment, the different flavors, and so many implementation issues in the next set of presentations. Thank you.